bulk of my day in clinic is spent seeing 2- and 3-year-olds and trying to decide whether they could have autism, but I also follow children of all ages up through teenage years who have autism, as well as other developmental diagnoses. So why should we screen? Why is this really important? Well, 7 out of every 10 kids with developmental disabilities often don't get identified until they start school. And by then, they've lost some valuable time when they could be getting services and supports. And then the other important thing, and a lot of times providers will say, well, I can tell clinically, I can just see kids and I know whether, there's something going on or not. And while that we think that is true, studies have actually found that 67% of the time it isn't true. And in fact, in very young kids, if we don't screen early for those delays, we miss them 2 out of every 3 times. And that's in the very young kids under 2. As kids get a little bit older, clinical assessment certainly comes into play. And I'm not saying that's not important, but screening tools definitely help us better identify those children that warrant those additional evaluations. So what about autism screening in particular? And since we're focused on the MCHAT, I focused on that. So a child who fails an MCHAT screen, what happens ultimately with those kids? Well, at least half of them do end up with a diagnosis on the autism spectrum. But even more importantly, about 89% of them have some sort of developmental delay. And almost all of them, 98% of kids who fail an MCHAT have some sort of developmental concern that warrants further evaluation. So you can see that by using this tool and screening early, we're identifying a huge pool of kids that really warrant additional evaluation. And in the end, at least half of those end up with a diagnosis. So it's a really good tool, and it really helps us screen and figure out who needs those additional assessments. It's also one of the Access approved screening tools that's an autism specific screen. There are a lot of general pediatric screens that are not geared specifically for autism, and I'm not talking about those tonight. They're very useful as well, and they definitely help identify kids with delays or other challenges. But since we're focused on autism, I'm sticking with that tool, and the one that is most used and most validated and approved by all the insurance plans is the MCHAT. Now, there are different versions of the MCHAT, but the one that we use now is called the MCHAT revised with follow-up, and that should be the one that you have a copy of. The nice part about this tool is, again, it is a screener. It's not meant to diagnose. It's a screener, and it helps identify kids who could be at risk. And it can be used anywhere from ages 16 to 30 months. And those are key ages to remember. So if a child is much younger than 16 months, it's not going to be a valid tool to use. Or if a child is much older than 30 months, it also isn't the best tool to use. Although a lot of times people ask me, well, if the child is 3 or 3.5, should we not do an MCHAT? And I often say, well, if you're concerned, it doesn't hurt to still do the MCHAT. And if the score is concerning, then there's definitely concerns, but it's not technically valid for that age. The nice part about this is it only takes a couple of minutes to fill it out, and it's really quick to score. And so the recommendations currently from the American Academy of Pediatrics are that every child at their pediatric well visit at 18 and 24 months get this tool administered. So the parent, guardian, whoever's with the child fills it out at those prescribed visits. But it can also be used whenever there's a concern, again, as long as you're in that appropriate age range of 16 to 30 months. And the reason they picked the 18 and 24-month visits is because those are common times for a child to go to the pediatrician for a well visit. We didn't choose the 15-month visit because they're not yet 16 months old. We used to recommend a 30-month visit, but most kids don't actually go for a well visit at 30 months. So the most appropriate times when they're already at the pediatrician are those 18 and 24-month visits. But again, anytime there's a concern, it can be utilized and it could be helpful. Whoops, that was just another picture. So how does the MCHAT work? Well, the parent or whoever is with the child that knows the child well should complete the form. And it's basically 20 questions and it's just yes, no answers. It's important that the parent or guardian complete all of the items and don't miss any. And whoever is scoring it should look for any unanswered items to make sure they follow up and just ask the parent again, what about this one? Sometimes parents have a hard time choosing yes or no. They're like, well, sometimes, maybe. But again, it's important they just think, is it yes? Is it no? What's most often true? And then when you're scoring this, it's actually also very easy because there are only 3 items where the correct answer is no. And those are items 2, 5, and 12. So on those, you're looking for the answer to be no. And if the parent answers yes on those items, then it's considered a concern. All of the rest of the questions, the correct response is yes. So anywhere else on the form that you see a no, it would be concerning. And we'll show you a little bit later the actual scoring, but it's really quick and easy. They even, you can print off a template that makes it easier if it's hard sometimes to follow what line you're on. But basically you're looking for yes responses, and all the yes responses are correct and reassuring. No responses would be more concerning, except for those few items. And then once you have a score, we'll talk more about what that means and what to do with that. Questions about that before I move on to the actual scoring?
Don't see any in the chat.
Okay. So basically, once you've scored it, you're looking for how many items. Oh, someone have a question? Okay. Once you've scored it, you're looking for how many items were the concerns, right? So either a no answer or a yes answer for those few questions where we wanted the answer to be no. And if when you score it, your score is 0, 1, or 2, that's very low risk, that's very reassuring, and you really don't have to do anything else except follow and monitor that child like you always would. So that's a reassuring low risk category MCHAT. The alternative is if you have 8 or more answers that are considered at risk or high or incorrect, that's a high risk child, and they should be referred immediately for additional evaluation. You don't have to do anything more with that other than refer them. The tricky part is those kids in the middle. So if they score between 3 and 7, it's considered medium risk. And those are the kids that really warrant doing the follow-up interview with the parent. And sometimes people will say to me, I don't have time to do that. I can't go back and interview the family about 20 questions. That's going to take too long. But the good news here is you don't actually have to do all 20 questions. You're only asking more details about the questions that they failed or the items that were concerning. And then once you've done that, some of those answers may change or they might not. But if you have at least still 2 items that are failed after the interview, then you're still going to refer them and they're considered higher risk. And I'll show you some examples and we'll go through this because I know it may seem a little confusing, but the easy part is the categories on either end. So 0 to 2, no worries, monitor, surveillance as usual, but low risk, not really a concern. 8 or higher, high risk, refer for additional evaluations, services, therapies. It's that middle group that gets a little more complicated, and we're going to talk more about it. This is just showing the same thing another way. So if you have 8 or more fails on the screen, you're considered high risk. You need referrals and services. If you're between 3 to 7, then you need the interview. And if there's 2 or more concerns on the interview, that also pops into that high risk group. This doesn't show the low risk group because again, those are the kids you don't really have to follow or do anything special with beyond their usual care. So what are critical questions on the MCHAT that can help you when you're seeing kids, even if you don't have the MCHAT in front of you? What kind of things would you want to be asking or thinking about when you're chatting with a parent or guardian, or even just interacting or looking at the child? So these are the key things you want to focus on. Is the child interested in other children? Are they curious? Are they noticing? Are they, trying to engage with the other kids if there's other kids in the room? Does the child point with one finger to show something? So if they're in a new environment and they see something cool, even if they don't have any words, they should point and be looking to the parent or guardian like, hey, look at that. Isn't that cool? They don't have to say a word. They're just pointing, and it's got to be with that index finger, because some kids point with their whole hand or another finger, and that's more concerning. So you're looking for the index finger and you're looking for it to show something interesting. They don't need help. It's not, oh, I want you to give me that, or I need help with this. It's just, oh, look, isn't that cool? Another thing you can look at is, does the child show you things, bringing them to you, holding them up so you can see it? Again, not for help, not because they need something, but just to share it. So a lot of kids will bring things over when they need help, right? When they need something opened, or when their iPad dies and they need it plugged in, or you know, they need you to help them with something about it, but it's more just to share it, just to show you because it's interesting. Does a child try to copy, imitate what you do? So whether it's peekaboo, you know, whether it's a facial expression, a gesture, you know, if you clap and smile, does your child clap and smile? Copying what they see their parent or guardian do, that's imitation, and that's something we want to see. A real quick, easy one is just, does the child look when you call their name? And again, this assumes they can hear, but if children aren't responding when you call their name, it's concerning. Doesn't necessarily mean, none of these mean autism right off the bat, but they're just easy, quick things to look for. And if you're seeing some of these aren't happening the way you would expect, it is concerning. And then if you point and look at something, does the child look? So if all of a sudden I point and I say, oh, look at that, you know, people that are around me would look at what I'm pointing to. And so it's checking to see if they pay attention and look at the thing that their parent or guardian is looking at, and with the gesture especially. So these are critical questions. These are on the MChat, but again, even if you don't have an MChat and you're just seeing a child or talking with a family and thinking about what the child is doing or not doing, these are key things to think about when you're trying to sort out, should I be concerned about this child and potentially being on the autism spectrum? So what could lead you down a path of either a false negative or a false positive? In other words, you do the MChat, you have a score, but you're concerned, maybe this isn't accurate. Maybe this really isn't what I'm seeing. Well, of course, if the parent or caregiver doesn't fully comprehend and understand the questions, then they might answer them wrong. And so it's important to review it with the family and make sure that they really understood the questions and answered them correctly. Another one is if you administer this too early. So if a child is younger than 16 months, the answers may be accurate, but again, it's not indicative of what we're looking for, because a 12-month-old may not have all these skills yet. And so if you do the tool too early, you may get a higher score, but it doesn't mean the child has any kind of issue. It just means developmentally they haven't gained these skills yet. The other important thing to know is about 30% of kids who end up on the spectrum have typical development up to a point, and then they kind of just plateau and they don't keep gaining skills. A smaller percentage actually regress and lose some skills. And so if you screen them too early, you could miss the kids who actually do have concerns because they haven't gotten to that point yet where they're going to show it. If a child has other developmental delay, they may score in a higher range, and it's because of other things, not because of autism. Excuse me. So if a child can't see, can't hear, has global developmental delay, even though they're 16 or 18 months developmentally, they may not be at that point, and then the answers are going to look problematic when in reality you have to take into account where they are developmentally. And then you certainly want to know that they can see and hear, because if you can't hear, you're not going to respond to your name. If you can't see, you're not going to make good eye contact. You're not going to look at something someone's pointing to because you can't even see them doing that. Sometimes mild symptoms, you may not see it at 18 months. So even if a child screens at 18 months and everything is looking good, it still could occur later. And so sometimes the MChat at 18 months looks very good, But then at 24 or 30 months, there might be more concerns because it just hasn't happened yet. And some kids do show the signs and symptoms later, especially if they're on that milder part of the spectrum. So we do talk about, you always have to look at clinically, what are you seeing? Even if the screen is negative, if you have concerns or if the parent and guardian has specific, really significant concerns, go ahead and refer for the evaluation, get them into early intervention, get them started in services. It doesn't hurt anything to get that going. The flip side is really not so much of an issue, because if the screen is really positive and their kid is high risk, you're going to refer them anyway, even if clinically you're not totally convinced it's accurate. But as long as you've gone back through and looked at it and made sure the parent or caregiver understood the questions and answered them correctly, then it's a pretty reasonable, valid tool, and it's usually pretty accurate. So here's an example. And it might be a little hard to see, but again, the MChat on the right, someone has circled all their answers. And the only two answers that are concerning are number 12, because again, that one we're looking for a no answer and they answered yes. And number 19, where they said no and we wanted a yes. So they only got two that were concerning. All of the rest of the answers were what we would expect. So their total score is 2. So with a score of 2, they're really low risk. You don't need to do anything more except follow them. And then if you really hone in and look at what are the two questions that were concerning, one of them was about getting upset with everyday noises. And then the other one was, if something new happens, does your child look at your face to see how you feel about it? And they said no. So again, this might be a kid to double check hearing if it hasn't been done recently. And then just thinking about, being aware of this is a child who's just sensitive to noise, but everything else is looking good. Questions about that one or anything we've talked about so far?
I don't see any in the chat yet, but feel free to pop them in as you're thinking of.
Yes, please do. I feel like I'm kind of going quickly, so I don't want to not address any questions or concerns. I don't know if it's helpful to go back through and read each of these questions and go over them. We can do that. I have more to share too, but I think the questions are pretty self-explanatory. I don't know if everybody's had a chance to read through them beforehand, so we can certainly do that.
So I do have one question coming in. If a child has already had a hearing test and all was okay, then what would you recommend doing at that point?
So for this case, you mean, I assume?
Yes, this is one question that came in. Yes.
Okay. So in this case, if they've had a hearing test and their hearing was fine, I wouldn't necessarily do anything specific other than to chat with the family about things they can do, when the child is upset, if it's an everyday noise like a vacuum cleaner, give the child a warning before you're going to vacuum. Maybe they go into another room. Maybe you vacuum when they're not there. Just thinking about, this is a child who's sensitive to noises, so I'm going to try to take that into account when I'm doing things. And sometimes they just need a heads up so they're not startled. Or again, you might choose to do some of those more noisy things when they're not around. Obviously, most parents aren't going to vacuum when their child's trying to sleep, right? Because you don't want to do anything that makes noise that could wake them up. But just thinking about those things. And then if it's the fact that they're not really looking to how you react, again, that might be that you need to just prompt them, or it all depends. Maybe they're not paying attention. Maybe they're focused on something else. Again, these two answers aren't super concerning in and of themselves, as long as the child can hear. And this is a child that doesn't necessarily need any additional big follow-up or services. It's just addressing the concerns. And the parent might not even be that concerned about it, never even really thought about it till they had to answer these questions. So the point is, though, it's very low risk for a diagnosis on the spectrum. It's pretty low risk for much of anything other than just thinking about this child is sensitive to sounds in their environment. And we all have things that we're sensitive to, whether it's noises, whether it's the fingers on the chalkboard kind of sound, or whether it's textures. There's lots of sensory things that happen in our world and in our environment. And some people are more sensitive, some people are less sensitive. So those by themselves don't equal a concern. Anything else about this example?
I don't see any more. She said, thank you.
Okay. It is good, though, to always recheck the hearing. And sometimes people will ask me, oh, well, they checked the hearing when the child was born and everything was fine. But if the child is now 2 or, even 18 months, that just because it was fine when they were born doesn't mean it's still fine. So anytime there's a concern about speech, language, or hearing, recheck the hearing and just be sure. It's a quick enough, easy enough thing to do to make sure we're not missing something like hearing loss. So here's an example where it's a little busier on the slide, but again, there's a lot of answers that are concerning. And so with this one, there are 11 answers that are scored not the way you would want to see them. And so that kid would be high risk. So if you gave this MCHAT to a parent or guardian, and this is what you got back, and when you scored it, you realize, oh, wow, there's 11 things here that are answered not the way I would have expected. They need immediate referrals. So they should get a hearing evaluation. They should be referred for early intervention. They should be referred to see a developmental pediatrician and probably for a speech evaluation. But if this might be the good one to kind of go through the specific questions and just make sure they make sense, and that you guys understand kind of what we're asking, so that if you ever are giving this to a parent or guardian or reviewing it, you know kind of how to ask for more information. And we're going to talk about more details here in a minute. But basically, the first one is, if you point at something across the room, does your child look at it? And again, we already kind of talked about that one as a key critical item that we're looking for. And so basically it's, if you point to a toy or a stuffed animal or something across the room, does the child look where you pointed? And in this case, they said, no, that's concerning, because again, you would want that answer to be yes. The second question is, have you ever wondered if your child might be deaf? And again, they said, yes, they've been worried about that. That's concerning. That's the one where you would want the answer to be no. And those are sometimes the parents who say, yeah, I talked to them and I don't think they're really hearing me. I don't know if it's because they can't hear or they're just ignoring me, but they don't respond. Does your child play, pretend, or make believe? And there's an example here because, again, I think a lot of times families aren't sure what we mean when we say that. So pretending to drink from an empty cup, pretending to talk on a phone that's not an actual phone, or pretending to feed a doll or stuffed animal. And so with those examples, I think most parents have an idea of, oh, well, yeah, my child does that, or no, they don't. And in this case, they answered yes, and that's the answer we would want. Yes, they do that. That's pretend play. Does your child like climbing on things, furniture, playground equipment, stairs? Again, looking to make sure that they have good motor skills to do that. And there we would want the answer to be yes. Does your child make unusual finger movements near his or her eyes? Example, wiggling his or her fingers close to the eyes. So kind of like this, but it can look a lot of different ways. Sometimes it's one hand, both hands. Again, I think most parents, if they saw that, would recognize that's not something we would typically see. And so that one, this patient answered no, but a concerning answer would be yes. Does your child point with one finger to ask for something or to get help? Pointing to a snack or a toy that is out of reach. Now, in this case, there's going to be a couple questions about pointing. So the first one is just to get help. And in this case, they said no, that's concerning. Again, we'd want the answer to be yes. But then the next one is, does your child point with one finger to show you something interesting? So again, an airplane, the kid who points to get you to look, oh, look, there's an airplane up there, and they don't have to say a thing. Or again, a big truck they see outside, or something new that they discover. And here you would want the answer to be yes, and they said no. So that's concerning. That's why there's an arrow by it. Is your child interested in other children? Does your child watch other children, smile at them, go to them? So again, even at 18 months, if you put them down and there's other children around, they should be curious. They should be smiling. They should be looking, wondering what they're doing. And here the answer was no, which is concerning. The next one, does your child show you things by bringing them to you or holding them up for you to see, not to get help, just to share? Again, that kind of sounds like the other one, but this one isn't focused on pointing. It's focused on just showing the object. So similar to the other question, but slightly different. And again, here they said no, so that's concerning because we'd want that one to be yes.
Dr. Riley, I did get a question about finger pointing. Is it a learned behavior?
Yes and no. So, I mean, certainly if kids see us pointing, they might copy us pointing, but even a child who's never seen it should do it. I mean, again, it's hard to judge for sure because I don't know if I could say that they've never seen it, but I guess there could be a child who never saw anyone point and we would still expect them to point. So it's a little bit of both. But you know, if someone says, oh, well, I never point anything, they've never seen me point, that's why they don't point, that's not a good answer. They should still point. Let's see, I think we're up to question 10. Does your child respond when you call his or her name? I mean, again, pretty straightforward. If you call the child's name, they should turn and look. And if they don't, it's concerning. When you smile at your child, does he or she smile back at you? Again, you would hope that when you smile, they instinctively smile back as long as their vision is okay. And in this case, this child does do that, so that's good. So that one was not scored as an abnormal response. Does your child get upset by everyday noises? In this case, it's no. That's the one we would want to see be answered no. Does your child walk? Yes. I know that might seem like a silly question, but we certainly see this is trying to get at also if the child is globally delayed or has some other physical impairment that might be contributing, we have to take that into account. And again, by 16 months, most kids should be walking. Does your child look you in the eye when you are talking to him or her, playing with him or her, or dressing him or her? And again, we would hope that would be yes. And it is here. Does your child try to copy what you do? Wave goodbye, clap, make a funny noise. Again, all of those things are imitation skills. Kids imitate very early. Infants imitate. And this one, luckily, is a yes. That's what you would expect. If you turn your head to look at something, does your child look around to what you are looking at? And again, that's the example I was giving, although in this case, it doesn't say pointing, right? It's just you turn to look. Do they follow your gaze and look? And in this case, it's no, which is a concern, and that's why it's scored. Does your child try to get you to watch him or her? So example, do they look at you for praise or say, look, watch me? So a child who's doing something, they do a good job, they start clapping, they look to see, is mom watching, is dad watching, is whoever watching? And in this case, it was no, and that's concerning. Does your child understand when you tell him or her to do something? So, and here it's relying on not using a gesture. So if you just said, bring me your blanket, or put the book on the chair, and you don't point, you don't give them the visual, are they able to follow that command? And in this case, it was no, and that's concerning. And if something new happens, does your child look at your face to see how you feel about it? So if they hear a strange noise, are they looking like, oh, what does mom or dad think about that? What does my guardian think about that? And they should be looking for a reaction from you when it's something new. And if they're not doing that, it's concerning. And in this case, they said no, which is concerning, and that's why it's scored. Yep.
So quick question that came in. If a child is not walking for some previously identified physical disability, the parent would answer no to question 13. But would you count that towards the overall score?
Yes, you would still count it.
Okay.
But you would know the reason why, right? So I think, you know, the score is the score, but that's where that clinical judgment comes in, right? So if this is a child who is in, let's say, in a wheelchair and not walking, for another obvious identified reason, you still answer it no, but you take that into account when you're interpreting the score, right? So you're not going to say, yes, the child can walk if they can't walk, even though you know the reason why, but you can take that into account when you interpret the whole instrument and think about, well, I'm not going to really count that one. What about the rest of it? But technically you would still answer it no and count it.
So it's really
Does
up to
that
that provider. Yeah.
Right, it's using your clinical judgment, right? So I mean, again, I would hope that if this child you're doing a screen and you have lots of other concerns about this child, that one answer isn't going to kind of make or break what you do. So you're still going to answer it no, you're still going to add it into the total, but you're going to use your clinical judgment to decide how concerned am I about the rest of this, kind of taking that piece out of the equation. But technically the answer is still scored.
Okay. That it makes sense. Thank you.
Uh-huh. And then the last one, does your child like movement activities, being swung or bounced on your knee? And again, here we're looking for a yes answer. It was a yes answer. It didn't get scored. However, I will say there's some kids that don't like that, right? They don't want to be picked up. They don't want to be swung and moved and bounced. But again, if that's the case, that's concerning. It doesn't necessarily mean they're on the spectrum, but that's why a no answer there is concerning. So each of them, again, you're looking for, is it the answer I'm expecting, or is it the answer that's considered kind of incorrect? And then you just add them up. So it's really quick and easy to score once you know the three that are the opposite of what you're expecting, right? Because pretty much everything that's a no, you're going to count, except for those three questions that I told you, which were number 2, number 12, and now I forgot which one was the other one. I'd have to look back through, but anyway, there's 3 questions that you would want the answer to be no. Oh, 5.
Yeah.
Yeah. Was there another question, or someone was helping me with?
Yeah, they were helping. Yeah, they were helping.
Thank you for your help. It's hard for me to read this. It's small on my screen and my eyes are old, so I apologize. But anyway, here you can see there's clearly 11 arrows, 11 answers that were not what we would expect. This child's high risk. You're going to refer for all the appropriate services and supports. They don't need a diagnosis yet, right? This doesn't make a diagnosis. This is just a screening, but it identifies a lot of risk and it warrants then further evaluation. So what about that follow-up interview? Because again, often you have those kids that score in the middle, and what do we do with those kids? So with the kids that score 3 to 7, right, that middle range, you're then going to look at the items they failed, and you're going to go back through, and there's a whole, you can get the information online, but there's a whole booklet of the interview and what you're supposed to ask to make sure that these were actually answered the way you wanted them to be answered. And we're going to go through a couple examples just to show you. I'm not going to go through all the questions because that would kind of get tedious, I think, after a while, but just to give you a sense of how it works. And there is a whole booklet to do it. I don't know that many people actually do the follow-up interview, but it is recommended for those kids that score in that middle range.
Dr. Riley, there was a question about if there's a similar screening tool for 3 to 4-year-olds.
Not really. They kind of are, yeah, that's a tricky age where there really isn't. I would say, you know, if you have a kid between 3 and 4 that you're concerned about, it's not wrong to still do the MCHAT. It's just not technically validated for that age. So if a child passes it, it doesn't necessarily, it's reassuring, but it might not be that reassuring, right? Because they're older, you would expect them to already be doing these things. But if a child fails it at 3 or 4, then it's very concerning, right? So I think for those kids who fail and score high, even at the older ages, it just proves, yeah, I'm concerned about this kid. They need to be referred. They need a lot of services and supports. So it helps you if they fail. But if they pass, I'd still use your clinical judgment. It doesn't necessarily mean they're out of the woods, because they may have learned some of these things and they may pass, but it doesn't mean they couldn't still be concerned, if that makes sense, hopefully.
Thank you.
Okay. So it's not wrong to use it. It's just you want to interpret it more carefully when they're older, because technically it's really not meant for that age. There are other tools for kids 4 and up, but you're right, in between that 3 and 4, they're kind of in a a gray area and don't have a tool specifically for them. But I've certainly seen a lot of providers still use the MChat at 3. I just want you to be aware that technically it's only up to 30 months. But if a child fails at 3, then that's good evidence to do more things and to get them referred. So this is just showing an example of a question and the follow-up interview and kind of how you proceed with it. So unfortunately, now the way my screen is, I can't see it. Oops, did I go? Okay. But this was one where the parent answered no to pretend play. And so because they answered it as a no, and if they're in that mid-range, you're going to go back and press for more information to make sure it really should be a no. And so the first thing you would do is just, say, well, can you give me an example of anything they've ever done that you thought might be pretend? And again, they may say, well, I don't think they pretend. That's why I answered no. And then you're going to go through this list and say, well, did they ever pretend to drink from a toy cup? No, they never did that. Did they ever try to eat from a toy spoon? No. And again, you go through each one. Did they pretend to talk on the phone, feed a doll? But then you get to, did they ever push a car as if it was going along a pretend road? And they're like, oh yeah, they did that. And then you go through the rest. And then did they ever put an action figure in the car and drive it along? And they say yes to that. And so because they've now answered yes to 2 of these choices, and in fact, it's just any one of them, they actually pass. And this is actually a yes. So here's an example where going back and going through the interview, you're changing that no to a yes, and you're changing their score because they weren't thinking broadly enough about what pretend play is. And so this is one where doing the interview actually helps the family and you see that, yes, this child actually does do some pretend, and we need to change that answer. Now, if they had answered no to all of these examples, then it would stay a no and the score wouldn't change. But it gives you pretty specific instructions in here about what you're asking and then what the criteria is to change the answer. And so it could be if you just clarify what you're thinking in terms of pretend, they give you an answer right away and you can change it to a yes. But if they still say no, you really do want to go through each of these examples and make sure you've got a yes or no answer for each of them, because if you stop after just a couple, then your answer really isn't correct. And I know it feels like a lot and it feels tedious, but again, this changes the score and the child's actually doing something that the parent didn't realize counted as pretend play. Questions about that? We're going to do another example just to show you a different question.
I don't see any new questions.
Okay. So here's another one. Does your child point with one finger to ask for something or to get help? And so again, here, if the parent answered yes, you're not even going to go deal with this on the interview. But if they answered no and you're concerned, then you're going to ask them, well, if your child wants something that's out of reach, like a snack or a toy, how do they get it? And then see what the parent says. And if they don't give you an example that is like what is here in the choices, or if they don't, they might say, oh, well, yeah, then they point to get it. Then it's a yes, they passed. But if they don't say that, then you're going to go through each one. So then you're going to say, well, do they reach with their whole hand? Yes or no? Do they lead you to the object? Do they try to get it themselves? Do they ask for it using words or sounds? And if they answer yes to any of those, then you'd say, well, if you said, show me the doll, whatever, would the child point at it? And then if they answer yes to that, they pass this one. If they've gotten all of these first ones as a yes, so they'll reach for it with their whole hand, they'll lead you to the object, they'll try to get it, or they'll ask using words. But then when you say, show me, do they point, they say no, then it's still a fail. Or if they answer no to any of those, the reaching with the whole hand, leading, trying to get it themselves, then it stays no. Does that make sense? I mean, I think they do a pretty nice job of showing you through the flow chart how to work through it. And once you do these a couple times, it feels more comfortable than what it might feel like right now. But again, I think it's rare that we have to do the follow-up interview. It's rare that you're doing it on very many questions, but when you are, it's helpful because it can really help identify and clarify what the child is doing. And I think sometimes, even though it says point with one finger, parents may read it quickly and just think, oh yeah, he shows me what he wants. He puts his hand out there to show me, and they might answer it incorrectly. Or the flip side is true, like the pretend play, where they don't really think about every scenario that could be pretend. So this just helps narrow it down and really get to the crux of what we're trying to find out. And I see all the time kids in clinic who, instead of pointing with one finger, point with their whole hand. Or what I'll usually do is just ask parents, if your child wants something, how do they let you know what they want? And they'll say, oh, well, they get it themselves, or they pull me over to it, or, they point, but with their whole hand. Or sometimes they'll just say, oh, they, bring me into the kitchen because they want a snack. And then I'll say, well, if you show them two choices, how do they let you know which one they want? Do they point? And that's a good way to kind of narrow it down. But again, for this purpose, you're going through this very kind of almost rote script, but it's helping you clarify and identify whether the answer should be yes or no.
So Dr. Riley, where can people find this flow chart?
So this is all part of the follow-up interview, and it should be on the website where the MChat questionnaire is, as long as you're looking at the one that's the MChat revised with follow-up.
Okay.
If you're just looking, there's lots of versions of the MChat out there. And so if you're just looking for the MChat questionnaire, you're not going to see this. But if you find the one that has the follow-up interview, there should be flowcharts like this for every single question.
Mm-hmm.
And just one more. Again, does whoever it is show you things by bringing them, holding them up for you to see, not just to help, but to share? And so again, if they've answered no to this, which would be the whole reason you're going through it, then you're going to go through each of these questions. Do they ever bring you a picture or a toy to show you? Do they ever show you a drawing they did? Do they ever pick a flower and bring it over? If they find a bug in the yard, are they bringing it over? And again, you're looking for yes or no to each of those. If it's no to all of them, then it stays a no. If it's yes to any of them, then you ask, is this sometimes just to show you and not to get help? Because again, you want to clarify that they're not looking for help with something. So bringing over, the picture, but it's because they have the marker as well and they want you to open the marker, or bringing the picture because the paper ripped and they want you to fix it, is very different than just bringing it to show you. So you do need to clarify that it's not to get help. But if you go through it and they've said no to all of it, it stays a no. Otherwise, you can change it to a yes, and that might change the score in the end. I thought I saw a blink. Was there another question?
Oh, no, Laura has been posting the link to the MChat flow chart. So thanks, Laura.
Oh, thank you for doing that. All right. That was kind of all I had on the MChat. So any questions about that? I know it's a lot of information. But again, I think, oops, why did it do that? I think it's a really useful screening tool. I think it really gets at a lot of information really quickly. And I think for most parents and guardians, it's pretty quick and easy to fill out. It also comes in other languages. So that's helpful if a family isn't a native English speaker. I've also had interpreters work through it with a family, because again, sometimes we do have languages that aren't included, or if the parent or guardian is visually impaired, then someone's going to read it to them and get the answers. But there's ways around that. So just making sure that it's in a format the parent or guardian can understand, that they have time to fill it out, although it doesn't take that long. And then going back and looking to make sure they didn't miss a question. And if you're feeling like maybe one of them was answered just not correctly based on what you're seeing, you don't even have to go do the whole follow-up interview. You can just clarify and go through certain questions and make sure, that they understood what the question was. And I've seen that sometimes we have pediatric residents that rotate through, and they do these in their continuity clinic when they see kids for their well visits. And then they're expected to go back and look at it and score it and review it. And I've certainly had some of them say, oh yeah, I saw the parent said that the child didn't point, but then I saw the child point in the room. So I just clarified and then we changed the answer. So again, it's important to look at it and look at it in relationship to the child and not just assume that all of the questions were answered correctly, because we all make mistakes. And I mean, I've certainly answered things where I missed a question or I got off by a line and then the answers didn't match up. So it's good to go back through it and make sure it's correct. And then I just added this because I think this is a lot of the early signs of autism that we see in that first 2 years. And so if you're seeing some of these things, it could be concerning. And again, not all of these, well, none of this by itself equals a diagnosis. But certainly if a child isn't making eye contact, if they're not turning to their name and showing an interest in other kids, if they're not engaging in that pretend type play, if they're not trying to share with you things that they're doing, if they're not looking when you call their name, if they're not using gestures, so waving goodbye, if they only do it when you say wave bye, I mean, that's good that they're imitating, but they should also be doing it sometimes on their own. If they're copying phrases, sounds, things they've heard from TV, it might be fine. It might be concerning. If they're stuck on doing things in a very particular way, lining up toys, spinning wheels on a car, that could be concerning. If they have some of those repetitive movements like hand flapping, toe walking, again, the fingers in front of the face. If they're stuck on certain interests or toys and it's kind of almost obsessive, like they only want to play with that thing, or it's all dinosaurs all the time and nothing else. If they get really upset if you change the routine, right? So the child who lined the things up and has them just the way they want them and nobody can touch them or move them out of place. Or anytime you drive a certain way, they expect you're going to a certain place and then you don't go there and they get upset. Although having said that, a typical 2-year-old might get upset if you drive by McDonald's and don't stop, right? Because they're thinking, oh, we're going to McDonald's. So none of these by themselves equal a diagnosis. And then the sensory things. So rubbing items on their face, looking at bright flashing things, spinning things, or not tolerating bright lights, loud noises, certain textures. And sometimes it's not even loud noises, it's typical household noises. So the vacuum cleaner, the toilet flushing, the fan, the hair dryer. Those aren't necessarily super loud. They're kind of common noises that happen in a daily household. But if those are really bothersome to a child, it could be a sign of something more. I'd say, though, the other big thing to keep in mind is a lot of people have repetitive behavior. A lot of people have sensory things that bother them. And those by themselves don't equal a diagnosis. They're concerning and they could be red flags for autism, but they also could just be repetitive behaviors or sensory interests. You have to really look at that social communication piece as well. And there we're really focused on the engagement, the showing, the sharing, the eye contact, the play, the pointing. Because if a child toe walks, but everything else is looking great and they make eye contact and they play with other kids and they show you things constantly and they're imitating and their language is pretty good, then they just toe walk and that can be completely fine. Or if a child really doesn't like certain noises and they cover their ears for those noises, but everything else looks good, then it's probably not autism. It's just a sensory difference. And so it's good to be aware of these repetitive and sensory things. And certainly I think in this day and age, everybody is so much more tuned in to some of these red flags and warning signs, which is great. But you really do want to focus specifically on the social communication stuff when you're thinking about the spectrum, because we all have something sensory. I can't do tags. I cut tags out of all my clothes. I've always been that way. My mom would say from the minute I was, brought home from the hospital, I probably didn't like tags. And back then they didn't have tagless stuff like they have now. That was my sensory thing. but I don't have anything else in this realm of concern. And I think most of us, if we think about it, probably have something, either repetitive or sensory. So those, while it's good to be aware and it's good to be looking out and it's good that everybody is so much more in tune and aware, you want to look at a bigger picture than just that. Because I have had a few kids referred when the only concern was a repetitive behavior or a sensory behavior and everything else was fine. And I mean, it was good to see that child and be able to reassure that parent or guardian that everything was fine, but I also felt like the pediatrician or other provider could have probably done that if they'd been looking at everything else. But I think, again, sometimes we get focused and tuned in on one thing and thinking, oh, that could be autism. We better make sure it's not. And of course, I'd always rather be sure that it isn't. But I spend a lot of time teaching providers and pediatricians and family practice docs and nurse practitioners and everybody to really look at that whole picture and not just focus on the repetitive behavior, because the repetitive and sensory things are sometimes much more obvious, right? But you have to look at the social communication piece as well. And the MChat does a nice job of that. It looks at all of that.
Thank you, Dr. Riley, so much. If people have questions, you can post those in the chat. And also, it's good to also, what I tell parents is that even if you don't have a diagnosis or you're waiting on a list, there's still things you can do. So if there is a speech delay, you can ask your doctor for a referral for speech, occupational therapy. You still can engage them with socially, with children to develop those skills. So there are some things you still can do.
Oh, absolutely. And again, most services aren't relying on a diagnosis. So even to go to specialized preschool at age 3, they're just looking for the child who's behind. And they even classify it as preschooler with a disability or delay. They're not looking for that specific label at that time. Now, obviously later that label is going to be helpful. And the earlier we give a label, if it's appropriate, the better. But none of the things that would be helpful early on require a diagnosis of autism. And so absolutely, if there's concerns about speech delay, they should go get a speech evaluation and get speech therapy. If there's concerns about challenging behavior, let's figure out how to get them in for some behavior support or whatever. If it's all about fine motor skills, emotional, outbursts, sensory stuff, OT can be very helpful with that. And sometimes the sensory relates to feeding too, right? Feeding can be a big challenge. And there's nothing harder for a family than a child who doesn't want to eat, right? Because so much of our society is about eating, plus just for growth and nutrition, it's important. But the kids who won't eat, the kids who don't sleep, the kids who every single thing you try to get them to do, it's challenging and they're melting down and having challenging behavior. That's really hard. And so it doesn't need a diagnosis to get help. Obviously, the sooner they get a label, if it's appropriate, the more doors open for those services. But because there's such a long wait to get in to see us and get evaluated, absolutely, the sooner they get hooked into those services, the better.
I just really am grateful to you, Dr. Riley. Thank you so much for this really important information. And thank you all for coming and sharing your Thursday with us for Autism Acceptance Month. We really appreciate you being here, and just all of those resources that we did talk about, like the speech therapy, the occupational, different behavior, they're all on our website under resources. So we have all Tucson providers. You can call Maxine and I, and we can help get you plugged into those resources or those next steps and those developmental pediatricians that you need to see if you do have concerns and you scored high on the MChat. So we'll help you get there. So thank you, Dr. Riley, so much.
No, thank you. And all the hard work you and Maxine and everyone do at the Autism Society. We couldn't do it without you.
Thank you. It's a village here. So thank you, village. Right. Have a great evening, and just let us know anything you need. We're here for you. Thank you. Have a great evening.